Hey folks, Dr. Joe Esposito here. I'm so glad to be with you today. I hope everybody's having a good day. Life isn't always great, but the nice part is that, there's got to be a morning after, as the song from, what movie? Poseidon Adventure. There you go. Life changes. That's one thing about life. It changes for good or for bad. And so I'm trying to give you information to make your life as good as it possibly can be. And one of the things I've seen a lot, especially in the COVID and post-COVID era, is a lot of people coming in to us with depression. Now, many people don't realize they have depression. Somebody very near and dear to me, as a matter of fact, took long and hard work and finally said, I'm going to go see some counselors, and started getting counseling and worked through some issues. It may not have been depression, but it helped the brain function. Now, I am a huge supporter of mental health and of counseling. I think it's great. Not all counselors are good, but we work very closely with counselors, and many times they'll refer us to patients because of what I'm going to talk to you about now. Many times depression is related to something physical. The stomach can push up against the diaphragm. You might have acid reflux, heartburn, burping, gas, bloating. But the stomach has one main job. And that main job is to take proteins, whether it's from a carrot or a steak or whatever it's from, unravel them and chop them up into something called amino acids. The amino acid tryptophan becomes serotonin in the brain. Serotonin helps with depression. Tyrosine becomes dopamine. Tyrosine is an amino acid. Becomes dopamine. Dopamine gives you pleasure. When we're depressed, there's not a lot of pleasure. And so this is why sometimes when we're depressed, we do some of these things, these signs and symptoms, to try to stimulate dopamine release. Dopamine dump, we call it. Dump out this dopamine to give you that moment of pleasure. It's how heroin works. You take heroin and you get this rush. I've never done it. I have no idea what it's like. I've just seen documentaries on it. This incredible rush of euphoria, and then you crash. And when you crash, you crash really hard. And so the dopamine blows out, and then you don't have any for a while. So the quickest way to get the rush again is to do more heroin. So I've seen documentaries where people live their whole lives begging for $10, $15. They get that. They go buy a hit of heroin. They do the heroin. They crash. They come back out. They beg for money again. So it's all about the brain function when it comes to depression. So what can we do about it? Well, a lot of things. Fix the gut. Eat the right foods. Stay away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. Make sure the nerve and blood supply going to the brain is working. This is where things like chiropractic care comes in. Open up the nerve and blood supply. Family contact, physical contact. All these things are important, but many times people don't realize that they have depression, but they have the symptoms. So I'm going to teach you to look for the symptoms in yourself and also for the symptoms in your loved ones, and then start to consider what else is going on. Okay. So one of the things is shopping sprees. You find yourself covered up with so much debt because you went on shopping sprees. For some people who are depressed, it's not uncommon for compulsive buying on stores and internet, wherever you want to buy it. And it serves to distract you, and it also can be a self-esteem booster. I won. I won this prize. I bought it, but I won it. And that gives you that feeling of victory, and it's this momentary pleasure that you get from that. Sometimes called retail therapy, right? Jokingly, but that's a real serious thing. That's very short-lived, and it doesn't address the underlying cause of the depression. Also, be aware that shopping sprees could be a sign of a mania or a bipolar disorder. And so all these things are real. You might think, oh my God, that person's crazy. Well, yeah. And there's probably a reason for that. Most importantly, what can we do about it? What can we do to get to the cause of the problem? Whether it's neck pain, back pain, shoulder pain, mania, bipolar, depression, anxiety, ADD, ADHD, there's routes that we can go that can help the body get better. I'm not saying I have a cure for any of these. What I am saying is the research, it's clear that pinched nerves, digestive issues, acid reflux, not enough acid in your stomach, bad bacteria in your colon, bad foods can all enhance some of these problems. May not be the cause, but it certainly can aggravate it. So if we can take away the aggravating causes, then the body sometimes can reboot itself. Many times it can. And the reason I know this, I've been in practice a long time, and I've seen the anxiety, depression, the ADD, ADHD, bipolar, suicidal. I remember one time somebody called me, remember years ago, one of those things that sticks in your brain. He was in Tennessee, and he was just manic, just going nuts. He goes, Doc, I don't know, I got to see you right away. I listen to you all the time. Oh my God, I got to come see you. I'm in Tennessee. I'm getting in the car right now. I'm coming to see you right now. And sure enough, about an hour and a half later, guy shows up at our office and he's just manic crazy. And he's saying, I'm going to kill myself. I'm going to kill myself. So I got scared. So I sat him down. We talked through it. And he was doing tons of artificial sweetener, like a couple of 6-packs a day. And that affects the brain. And it's what's called an excitotoxin. Aspartame is an excitotoxin to the brain. So we sat him down. We calmed him down. I gave him some magnesium supplements. I adjusted his stomach. We got him some food, some real food. And I said, come back every day this week. And he did. And after a couple of days, he came back in totally different person. And he said, you saved my life, Dr. Joe. He said, I driving here that other day, he says, I was going to be fine if I drove my car off the road and killed myself and anybody else. So these are real serious issues and they shouldn't be ignored. Somebody who drinks a lot. 1/3 of the people with major depression abuse alcohol. So 1 in 3 people are abusing alcohol if they have major depression. If you feel like you need to cope with anxiety and depression and you need a drink to cope with it, you might be one of them. Now, a drink may seem like it provides you a lift, but alcohol is actually a depressant. And you can go through these episodes then. So if you need a drink, it's an issue. If you want a drink, it's not an issue. It's a real simple way to determine if you have a problem. And it goes with alcohol, it goes with food, it goes with chocolate, it goes with donuts. If you want them, it's different. But if you have to have them, that's the definition of addiction. Now, on our website, drjoe.com, we did a great show on addiction. So just go to the website, drjoe.com, type the word addiction in the search bar. And by the way, we don't track you, by the way. So if you go to our website and you're looking up things, we don't know who you are. We have no way of tracking who you are. And listen to the show we did on addiction. We talk a lot about this brain interaction. And it's really important that you understand this because it could be a mild addiction. It could be a bad addiction. I was watching a sitcom the other day called Mom. And they were talking about alcoholics can be cucumbers or pickles. And a cucumber can go to the casino, bet some money, go home and feel bad about it, and it's over. And a pickle goes to the casino, loses all their money, and then moves to Las Vegas. And they said a cucumber can become a pickle, like a mild addiction can become a bad addiction, but a pickle can never become a cucumber. Once you're an addict, you're always an addict, is what they were saying. And so, same thing with alcoholism. People are alcoholics their whole lives, even if they haven't had a drink in 30 years. They're still alcoholics. So you have to consider, do I have a problem? And if I do, what's causing it? It could be depression. That's what we're talking about. Forgetfulness. Depression may lead to a feeling of grogginess, forgetfulness. Studies show that prolonged depression or stress can raise the body's level of something called cortisol. This can shrink and weaken the part of the brain associated with memory and learning. So the hippocampus and other parts of the brain, that's really the name of a brain, the hippocampus, can actually shrink with high levels of cortisol. So if you're under constant stress, whether it's chemical, emotional, physical stress, the cortisol levels rise, and that can affect your brain long term. So physical stress is usually easy. That's where chiropractic comes in, nutrition, digestion. Let's get the body physically tuned up. And that's what we do in our offices. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We're really good at it. So we can work with the physical issues. That's something that we're trained at. We've been doing it for between all my doctors, a couple of 100 years probably. So we're good at getting people out of pain and dealing with physical issues. Chemical issues are what you eat. So my secret to eating is get the bad food out of the house, especially if you're an addict. An alcoholic cannot have alcohol in the house. If you're overweight, you shouldn't have meats and sugars and dairies and coffee in the house because you're going to go for that, especially the sugary foods and the fatty foods. So getting the bad food out of the house is always a key for everyone, actually, because if it's in the house, chances are you're going to eat it. So we want to get the body working. You got to decide what to eat. If you don't know what to eat, go to our website, drjoe.com, DRJOE, and type in the words, the 7 Deadly Sins of Nutrition. Listen to that show. It's a lecture we did out in California a couple of years ago. Listen to that. Then there's a second show called So What Can I Eat? It's not even a show. It's just me talking. But listen to the show on what can we eat. It's going to talk about what to eat. Okay? Let's do that. And that's going to tell you what to eat and what not to eat. That's going to be very helpful for you. And then you have a starting point coming up for your future. With the forgetfulness, we talked about the acid reflux. If you have acid reflux, you're not breaking down your proteins properly. All my doctors, by the way, handpicked by me, trained by me, and they're my personal doctors. And if a doctor doesn't cut the mustard, they don't stay with us for long. So all the doctors I trust taking care of me, my assistant Joe, my staff members, people I care about, And so if I trust them taking care of those people, I trust them taking care of you. You're in amazing hands, in my opinion. My opinion, some of the best doctors in the world work at our offices. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. So if you'd like to come and get checked out, let's check the nerve and blood supply to the brain. Let's check the digestive system. Maybe you have back pain, leg pain, hip pain, numbness, tingling, headaches. Stop suffering needlessly. Biggest complaint I get it every day. Biggest complaint I get, why didn't I do this sooner? Why did I suffer for so long? And the answer was this easy. And people get mad. How come nobody ever told me to do this before? I don't know. It's not my job. My job is to tell you to do it now. So if you want to make an appointment, all 4 offices are accepting new patients this week. You can go to our website, drjoe.com, and you can book it right online. It doesn't have to be this week. Could be in the future. We accept insurances for almost every insurance out there. We try to work with copays and deductibles. We try to make it as best we can for you. And normally the first visit is $712. That's an exam, x-rays, consultation, first adjustment, going over the x-rays on your follow-up visit, complete nutrition evaluation. We spend a lot of time with you. Normally it's $712. We've reduced that to $299. So if you're ready to get well, now is the time to do it. And, well, of course, that number can't stay there forever. But just book your appointment. The nutrition alone is $150. So you're getting I'm making you an offer you can't refuse, as we say in New Jersey. So make the appointment right now. Atlanta, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Do it right now. Don't waste time. If you're driving, don't do it now. Wait till you're done driving, and then you can pull over and do it. But we want to see you. We want to see you this week. And bring in your friends, your family, your children. Children that start out healthy usually are healthy. Children don't start out healthy usually have a lot tougher time in life. So let's do it now. I want to see you all this week, drjoe.com. Make the appointment. Other signs of depression, people that can't get off the internet. Now, this is a big issue because when you're on the internet, when you're scrolling, and it happens to me, it happens to everybody, it releases pleasure centers in your brain, and you get very high from it. So it's very hard to not do it because it's legal. It's not alcohol. So a lot of people do it. Now, if you lose your phone, has anybody done that before? If you lose your phone, the same part of the brain lights up or becomes active as what happens when you lose a loved one, when somebody dies. So that's how anxious people get when they lose their phone. And it's actually a physiological and a neurological reaction that occurs. So yes, we are addicted to our phones. But if it starts interfering with your life, you start fighting with your family, your spouse, your friends, your job. We have had to fire people in the past because they couldn't put their phone down. And I get the addiction. I'm totally on board with the addiction. But you got to deal with it. You can't come to work and drink. You can't come to work and do drugs. You can't come to work and play on your phone. And the biggest complaint I have when I talk to all my colleagues, and I talk to a lot of people in the healthcare field, the staff, they can't put their phone down. I get it. You have to acknowledge that it's an addiction or depression, and then what do we do about it? And then we get the body healthy, we get the nervous system working, digestive system working. Other signs of depression, of course, is eating, binge eating, and obesity. Study out of University of Alabama. Young people report being depressed. They tend to eat and gain more weight around their waist. And if you have that big gut, it's a high risk of heart disease. One of my coworkers at the radio station, he's on one of the other stations that I'm on, and he decided he's going to go on a 21-day cleanse. And that's on our website, drjoe.com. 21-day cleanse. And he's got this big gut on him. And he said, Dr. Joe, I got to get rid of my gut. And I said, you are high risk. And he's very famous. I said, I don't want you dying. He said, I don't want to die either. And he's got kids. So I said, let's do this. And he did it, and his co-host was doing it too. And she's whining and complaining, oh, I got to take a lot of supplements. I'm not good at taking supplements. And I'm surprised that he has now jumped on board. And I'm really excited that he's with us on this. So if you want to do the 21-day detox, it kind of jumpstarts your weight loss program, and it resets the brain. It's on our website, drjoe.com, and just type in 21-day cleanse or 21-day detox. It'll come up. But binge eating and obesity could be a sign of depression as well. And we've got to be careful with that. If you're doing it, you say, I can't stop. Why can't you stop? And again, let's get the nervous system working, the digestive system working, your diet straightened out. And in many cases, that can help pull you out of that depression and get the body working again. Even shoplifting. I mean, you hear these stories. Somebody famous, Winona Ryder, I think it was years ago, was caught shoplifting. Okay, they got more money than God. They don't have to steal anything. A third of shoplifters suffer from depression. Some people who feel powerless and insignificant or from the depression get this rush, this high that I got away with something. And so they do it just to get that momentary rush. It's like a drug. It can also provide a rush to counter depression, which sometimes people feel numb when you're depressed. And we've all been there. Death of a loved one, ending a relationship, issues at work, issues with your family. You just become numb. And so the shoplifting might give you a little high. They do it because they're depressed. Their feelings are more important than the item they're stealing, of course. It's not that they want to steal the shirt that they can't afford it. They're just trying to get a little high from it. It's all about that high. We're always seeking pleasure. We want pleasure all the time. The easiest way to maintain a steady level of not euphoria necessarily, but sanity and stability is making sure the nervous system is working properly, the digestive system is working properly, and your diet is right. So minimum supplements, because people always say, what supplements should I take, Dr. Joe? Supplements are easy. Minimum supplements would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. You could add some frozen blueberries to them. I like it with frozen banana, make it creamy and rich. I just use coconut milk or almond milk and shake it up. Some people love it. I love it. Other people say, well, Dr. Joe, I'm not thrilled. So add some frozen bananas to it. Get it in your system. Okay, I don't care how you get here. Just get here. That's a quote from Oleta Adams, song from before you were born, probably. So Super Greens and Essential Source. Nitric oxide. Nitric oxide opens up the blood vessels, increases circulation to the brain. Omega-3 fatty acids, absolutely positively necessary for brain function and to decrease inflammation. They're essential omega-3 fatty acids, which means you have to get them from an outside source. So that's part of my brain protocol. Probiotics, good bacteria, because you have to break down the food in your gut to release the chemicals to make the neurotransmitters. So there's a process here. And I want you to follow that process. But the easiest thing is just come see us, and we'll put together a protocol for you. Check your digestive system, check your nervous system. You can have a pinched nerve and not know it. In fact, 90% of your nerves don't feel pain. You can have a pinched nerve because you can pinch a nerve, let's say, to your liver, your spleen, your kidneys, your blood pressure. You don't feel these things. So if you don't feel them work, you don't feel them not work. That's why it's so important to keep the nervous system healthy. I cannot stress enough my feeling that everyone should have a chiropractic evaluation. I can't imagine why anyone wouldn't get a chiropractic evaluation. I don't have any pain. 90% of your nerves don't feel pain. That's why you get it checked. You get your engine checked before it breaks. You get your blood pressure checked. Why not get your nervous system checked? Most people have never had their nervous system checked. And when they come in our offices, they're blown away on what we find. So again, if you'd like to make an appointment, drjoe.com. We'd love to be your doctors. And one of the signs tying into this is back pain. One study showed 42% of people with chronic low back pain experienced depression before their back pain set in. So sometimes there's a physical manifestation of an emotional component. And so we want to get to fix the physical. We also then hopefully get the body to heal from the emotional. And that could be acid reflux and heartburn and gas and bloating and diarrhea. Those are all signs that the digestive system isn't working. Other signs of depression could be risky sexual behavior. I mean, they joke about, the girl at the dance club, she's trying to get the approval of her father. Or she's had issues at home. I know that's a serious issue. And that's not something to be taken lightly. But if you have this, or you know somebody with this proclivity, it could be a sign of depression. And so we want to dig a little deeper and find out why. Serious negative effects on health and personal life, of course, can come from this as well. So I want you to be real careful. If you see that in yourself or someone else, consider that maybe that's a symptom, not a problem. Okay, there's a difference. If it's a symptom, you got to get to the cause of the symptom. Get to the root cause. And that's what we always try to do in our offices. People with exaggerated emotions. People that are depressed sometimes show little emotional expression. So it's exaggerated to the negative, if you would. Other times they show too much. They can be suddenly irritable or explosive. They may express exaggerated feelings of sadness, hopelessness, worry, fear. They talk about it all the time. Some are caught up in a sense of worthlessness, or they feel the feeling of excessive or inappropriate guilt. It's my fault that this happened. The key is a sudden change in behavior. So if a person who is usually flat in their feelings become hyper-emotional, depression might be the cause. So I know sometimes you say, I got to get away from this person. They're toxic. This person is you're in a bad relationship, in a toxic relationship. Yes, you got to protect yourself, absolutely. But then you also got to consider, why is this person like that? And here's the thing. If you're in a relationship with someone, whether it's work or romantic or family, if both people are willing to work on the situation, I believe there's always a resolution. If one person isn't willing to work on the situation, there's never a resolution. It's like getting divorced. It only takes one vote. Okay, so what we want to do, and when I interact with people, is I always want to say, listen, are we both willing to work on this? And if we are, let's do it. If you're not, you need to find out why you're not willing to, and then get to that cause as well. So anyway, get on my soapbox there for a minute. But exaggerated emotions can be a real health issue, and it could be due to pain. We've had so many patients in pain. Again, I'm board certified in chiropractic, orthopedics, pain management. I'm double board certified in nutrition, certified in traumatic brain injury. I've got a pretty big background when it comes to healthcare. And I've had many people come to us, and after getting them, get their pain managed, get their body working properly, get them on good diet, fix their digestive system, their spouses come in and say, this is the person I married. What did you do? I lost them for years, and now they're back again. Thank you so much. People send us flowers. People bring in presents for my doctors. Thank you for giving me my life back. And I don't understand why everyone doesn't get that. It's not that hard. Let's fix everything we can and then see what happens. Can't fix everything. There are some patients we failed at. But a major majority of patients are very, very happy when they become patients with us. And many times it's an emotional issue as well, because pain can be make you miserable. I've been in chronic pain. I understand what that's like. And it's not fun. And you don't want to be playful. You don't want to be romantic. You don't want to be engaging. So that's why we try to get to the cause of the problem and not just fix the symptoms. Gambling issues sometimes can be a sign of depression. And gambling gives you that rush again, that adrenaline rush, as we call it. But if you gamble more than recreationally, well, you can't stop, or you want to move to Vegas so you could get closer to it, that could be an issue. No matter how quick a rush you get from gambling, it's never going to get to the cause of the problem. And that's why some people are serious gamblers. Now, some people are professional gamblers, and they, Kenny Rogers said, you got to know when to hold and know when to fold. And so that may not be the issue. But if you're doing it just to get a little bit of a rush and get high and get in the excitement and start drinking and you can't stop it, that's when it becomes an issue. Smoking, being depressed doubles your risk of smoking. Heavy smoking, more than a pack a day, and having a cigarette within 5 minutes of waking up. These are common habits of smokers that have depression. That's according to the Centers for Disease Control. Depressed smokers are less likely to quit, and so that's when you have to do a little more work with it. Now, a lot of the things we're talking about, not taking care of yourself, not going to the chiropractor, not working out, not eating the right foods, not exercising, these are all signs of depression. And so depression is a real serious issue. So I do recommend that if you have it or you know someone who has it, that you seek out professional help immediately. And counseling is great, but we want to take counseling to a whole nother level. We want to do the counseling along with the nervous system, along with the digestive system, along with the diet. Now we have a healthcare plan. Most people have insurance. They don't have a healthcare plan. What I want you to consider is coming to see us as a patient. Let's put together a healthcare plan. Do me a favor, folks. Follow us on social media. The handle is @Dr. Joe Esposito, Facebook, Instagram, YouTube, and Twitter. If you want to make an appointment, drjoe.com. Normally the first visit is $712. We've reduced that to $299, so do that right now. We are accepting new patients at all our offices, Marietta, Duluth, Stockbridge, and West Cobb, and Atlanta. And again, the website, drjoe.com.